In the morning, my face would be puffy. I would have a hard time breathing. Underneath my eyes would be black. I wasn't able to exercise the way I'd like to because of the postnasal drip and having a difficult time breathing out of my nose.
If what you just heard sounds familiar, you may be one of 37 million Americans suffering from chronic sinusitis. Symptoms of chronic sinusitis include facial pressure or pain, headache pain, congestion or stuffy nose, thick yellow-green nasal discharge, bad breath, or pain in the upper teeth. Now there's a minimally invasive technology used by ear, nose, and throat physicians to relieve symptoms of chronic sinusitis. This technology is called balloon sinuplasty. Hear how balloon sinuplasty technology has changed the lives of former sinus sufferers.
I could smell smoke. I could smell that there was a fire close by. And so I thought, oh my gosh, I can breathe already, and it's just been probably an hour or 2 hours. It has been about a year and a half since my surgery with balloon sinuplasty technology, and I have felt great. I have not had the reoccurring infections every month. I'm able to breathe. I'm able to sleep at night.
It felt like I had a wind tunnel, and I mean that's the way it sounded because my passages were all open. The nurses that work in PACU, and they were laughing at me because I could say, I can breathe, I can breathe. How I feel today after having this procedure approximately a year ago, it's like I never had any sinus problems.
I was basically not out of commission at all. I mean, I could have gone, even the way I think we did it on Thursday and was off Friday, I could have gone back to work that Friday if I wanted to.
Normally when you have a surgery, you can remember because you still have some sort of pain or some kind of recovery that you need to go through. And I haven't had to experience that at all.
I chose to have the surgery that utilized the balloon sinuplasty basically in lieu of taking medications as I viewed it for the rest of my life. It was the only alternative that I could truly see for me.
I haven't touched an Excedrin or any kind of headache medication in 5 months, which is great. And I haven't had any antibiotics or any steroids at all. So I'm pretty much medication-free as much as I can be.
I'm able to work my full day, plus also have energy when I get home. If I wanted to go out or do something recreationally, I would be able to do it. So overall, I think it's made a tremendous difference in how I approach my day-to-day life.
After the surgery, I think the word that sums it up is normal, because you know what normal is, and so I'm back to what I was many years ago when I didn't have any symptoms. So I'm back to being able to breathe. This has been a great experience for me to have this done and to be able to do the things that I like to do.
I would just tell people that if you are having problems, go see your doctor, see if that's an option for you, because your life, if that is an option for you, your life is going to improve 100%. If I ever needed to have this surgery again, I would do it in a second.
The sinuses are a series of interconnected hollowed spaces in the skull. Their walls are lined with mucus-secreting membranes. Small hairs sweep the mucus out of the sinuses so it can drain out through your nose. These mucous membranes may become infected or inflamed because of a cold or allergies, and can swell up and block the nasal passages so that fluid from the sinuses can't drain. Buildup of fluid in the sinuses causes pressure and pain. Doctors call this sinusitis. Acute sinusitis comes on quickly and then leaves. With chronic sinusitis, people have symptoms virtually all the time and take many courses of medication such as antibiotics to treat the inflammation. Severe sinusitis may require surgical opening of the passageways with rigid steel instruments placed up through the nostril to remove bone and tissue blocking the drainage. Recently, a new, less invasive technology called balloon sinuplasty has been introduced. Using this technology, a balloon catheter is delivered to the blocked passageway and is gently inflated, widening the opening of the passageway and thus allowing drainage and relief from the pain and pressure.
With the balloon sinuplasty technology, you are dilating that tissue and bone. You're not causing mucosal trauma. And this allows the ostia to stay open and drain the sinuses, which was our goal initially, and the advantage is that it's done in a minimally invasive way.
This is a technology that's based on sound clinical data and sound patient outcomes, and I think that really is where the foundation of the technology lies.
To learn if it's right for you, schedule an appointment with an ear, nose, and throat physician who's trained on the balloon sinuplasty technology. Visit balloonsinuplasty.com to find a physician near you.